Contraception or birth control is a method used to prevent any unintended pregnancy. Why do you need contraception after childbirth? Resuming sexual activity after delivery may take time, but is normal and should be encouraged. Many women, however, would prefer to plan when their next pregnancy occurs. Spacing out deliveries or an inter-pregnancy interval may be ideal for a variety of reasons. From a social and family perspective, it allows mothers to focus on the postpartum care of their child and gives women the choice when they plan to have their next child. From a medical perspective, observational studies suggest that an association between an interval of less than 12 months and preterm birth, low birth weight, and higher risks of serious complications, as well as maternal and perinatal mortality. Finally, for women who have undergone a cesarean section, an interpregnancy interval of more than 18 months is associated with a lower risk of scar rupture if one is planning for a trial of labor for the next pregnancy instead of a repeat cesarean section. How early does my fertility return after having a baby? The time for return to fertility may vary considerably among women. For women who are not breastfeeding, one can get pregnant from 21 days after delivery. For women who are breastfeeding regularly, this provides reliable contraception for up to 6 months after delivery. Is breastfeeding an effective contraceptive? The contraceptive effect of regular breastfeeding is also called the lactational amenorrhea method, LAM. Regular round-the-clock breastfeeding suppresses ovarian activity and prevents the monthly release of the egg and the return of menstrual periods after childbirth that is responsible for fertility. Fewer than 2 women in every 100 using LAM will become pregnant in the first 6 months. This, however, depends on the following criteria. 1. Fully or nearly fully breastfeeding day and night. Factors which affect this regularity, such as avoiding night feeds, expressing breast milk, using a pacifier, or starting other additional feeds, such as water or juice, may reduce contraceptive effectiveness. 2. Menstrual periods have not resumed. 3. Less than 6 months after delivery. This method is less reliable once you start reducing feeding frequency, such as by omitting night feeds, supplementing feeds, or expressing breast milk. The LAM method of contraception is also less reliable once more than 6 months have elapsed, or if menstrual cycles have resumed before 6 months have passed, in spite round-the-clock feeding frequencies. When you stop fully or nearly fully breastfeeding, there is a higher chance of getting pregnant. Many women may decide to use other contraceptive methods in addition to breastfeeding to reduce the chance of an unplanned pregnancy. There are methods available that will not affect your ability to produce milk and are safe to use during breastfeeding. Which form of contraception will suit me? When you choose a method of contraception, you need to think about how long you intend to be on contraception and plans for future pregnancies, its effectiveness and dosing, personal preferences on how it is administered, possible risks and side effects, as well as any medical conditions or drugs that you may have that may interact with a chosen method. What are the available methods of contraception? Available methods of contraception after delivery include lactational amenorrhea method, LAM, copper-containing intrauterine contraceptive device, IUCD, hormonal methods such as progestogen-only contraceptives or combined hormonal contraception CHC methods containing both estrogen and progestogens, permanent male or female sterilization. Other contraception methods are emergency contraception, condoms which provide additional protection from sexually transmitted infections, and the rhythm method or fertility awareness methods. Are hormonal contraceptive methods safe for me? Generally, hormonal contraceptive methods containing progestogens are safe at any time after delivery and can be started immediately. They are safe with breastfeeding. Combined hormonal contraceptives, CHCs, contain estrogen and progestogens. The pill is a very common form of the CHC. In women who have recently delivered, however, it is not given within 6 weeks of delivery due to a high risk of blood clots. As there may be some excretion of estrogen in breast milk, some breastfeeding women may opt for other options even though studies have not found harm to the baby. Additionally, CHCs may interact with several drugs and medical conditions, and a doctor should ensure that this is not a concern for you. Alternative non-hormonal long-acting reversible contraceptives include copper intrauterine contraceptive devices, although these have to be inserted either within 48 hours or more than 28 days after delivery due to a high risk of an injury or perforation to the womb that may need surgery. Long-acting reversible contraceptives, LARC. These are more suitable for women who do not want to get pregnant for a few years but wish to retain the option to regain their fertility. All of these options do not have long-term effects on your fertility. Depo-Provera or dipomedroxyprogesterone acetate DMPA injection. A 1 milliliter liquid is injected into the upper arm, deltoid, or at the buttocks, gluteus, every 3 months. It slowly releases a progestogen, a type of hormone which works by thickening the cervical mucus to obstruct the sperm and by preventing the monthly release of the egg. Less than 4 in 100 women get pregnant over 2 years. Advantages: lasts up to 14 weeks. Menstrual periods usually becomes shorter and lighter and may stop. It is helpful in women with heavy or painful menstrual periods. Protects against ovarian and endometrial cancer. It is very effective and can be safely started immediately after delivery. It is very safe and can be used with a variety of drugs or medical conditions, although this should still be discussed with your doctor. Safe to use with breastfeeding. Can be obtained easily at many general practitioners. Disadvantages: your menstrual periods may be irregular or completely stop. Associated with temporary progestogen-related hormonal side effects such as acne, bloating, breast tenderness, decreased libido, mood swings and headache. Does not protect against STIs. May delay return to fertility by up to 1 year after discontinuation, but no long-term fertility effects. Small loss in bone mineral density if used for several years, which returns once stopped. Associated with weight gain in some women. Copper-containing intrauterine contraceptive device, IUCD. The IUCD is a T-shaped device containing copper that is inserted into the womb through the vagina in a 5-minute clinic procedure by a trained healthcare professional. It can only be inserted within 48 hours of delivery or 28 days after. The most common types of IUCD last for 5 years. The copper inhibits the sperm penetration, and the IUCD itself prevents implantation of any fertilized egg in the uterus by causing an inflammatory reaction. A small thread is left about 1 to 2 centimeters from the cervix for you or your doctor to see that it is in the correct location and also to grab onto to pull when it is time to take it out. Less than 1 in 100 women will get pregnant over 5 years. Advantages: there are no hormonal side effects such as acne, headaches, or breast tenderness. It is safe to use an IUD if you're breastfeeding. Immediate return of fertility upon removal. It is unaffected by other medicines. There is no increased cancer risk with the IUCD, and there may be reduction in endometrial and cervical cancer risk. If inserted in women who are more than 40 years old, it can remain until menopause. It requires a trained healthcare professional to insert and remove. Disadvantages: it does not protect against STIs, so you may need to use condoms as well. It may occasionally cause painful, heavier or longer menstrual periods, although this usually improves after a few months. Small chance of infection in the first 20 days of insertion. It may rarely be pushed out by the womb in 5 out of 100 cases. Inserting may rarely injure the womb through perforation in 2 out of 1,000 cases. This may sometimes require emergency surgery to remove. In the rare event that it fails, up to half of pregnancies are not in the correct location and need emergency treatment, for example, ectopic pregnancy. Mirena or intrauterine system. is a T-shaped device the size of a 50-cent coin inserted in the womb in the same way as an IUCD. It slowly releases small amounts of progestogen called levonorgestrel into the womb, which thickens the cervical mucus to block sperm and thins the womb's lining to prevent implantation. It commonly lasts up to 5 years, although a 3-year option does exist. Just like the IUCD, it can only be inserted within 48 hours of delivery or 28 days after. Less than 1 in 100 women get pregnant over 5 years. Advantages: your periods can become lighter, shorter, and less painful. They may stop completely after the first year of use. This is a recognized treatment for women with heavy menstrual flows. It is safe to use a Mirena if you're breastfeeding. Immediate return of fertility upon removal. It is very safe and can be used with a variety of drugs or medical conditions, although this should still be discussed with your doctor. If inserted in women who are more than 45 years old, it can remain until menopause. It is a treatment for pre-cancer of the uterus, also known as endometrial hyperplasia, and may prevent it in women at risk, for example, women with high BMI, diabetes, infrequent menstrual cycles. Disadvantages: periods may become irregular or stop. This may not be desirable for some women. Small chance of infection in the first 20 days of insertion. Associated with temporary progestogen-related hormonal side effects such as acne, bloating, breast tenderness, decreased libido, mood swings, and headache. A small risk of small fluid-filled cysts in the ovaries that usually disappear without treatment. It should be avoided in women with previous history of breast cancer. It may be considered costly and costs about $300 to $400 with no subsidy available. It requires a trained healthcare professional to insert and remove. Just like the copper IUCD, it does not protect against STIs, so you may need to use condoms as well. Small chance of infection in the first 20 days of insertion. It may rarely be pushed out by the womb in 5 out of 100 cases. Inserting may rarely injure the womb in 2 out of 1,000 cases. This may sometimes require emergency surgery to remove. In the rare event that it fails, up to half of pregnancies are not in the correct location and need emergency treatment. Implanon or contraceptive implant. The implanon is a small, soft silicone rod placed under the skin by a trained healthcare professional in a 5-minute clinic procedure while using a local painkiller. It slowly releases a progestogen called etnogestrel, which thickens cervical mucus to block sperm, thins the womb's lining to prevent implantation, and prevents ovulation. Each implant is effective for 3 years. Less than 1 in 1,000 get pregnant over 3 years, and it is considered even more reliable than permanent sterilization. The implant can be inserted immediately after delivery. Removal is by a small cut in the clinic over the point of insertion, also under local painkiller. Advantages: can be inserted anytime. Return of fertility after removal is immediate. Helps with painful periods. It is very safe and can be used with a variety of drugs or medical conditions, although this should still be discussed with your doctor. No increased risk of blood clots, strokes, or heart attack. It does not affect bone mineral density. The most common change in bleeding pattern is to one that is infrequent. 20 in 100 women may have absent menses. Safe in breastfeeding. Disadvantages: changes in bleeding patterns may not be desirable. The implant may rarely be inserted or may migrate to a deeper location. If it cannot be felt under the skin, additional scans or surgery may be needed to locate and remove it. Does not protect against STIs. It requires a trained healthcare professional to insert and remove. Pill-based contraception. Progestogen-only pill, POP. This is a pill that must be taken at the same time daily. If a pill is missed by more than 3 hours, there is a risk of pregnancy. Traditional progestogen-only pills available in Singapore prevents pregnancy by thickening the mucus in the cervix to stop sperm reaching an egg. Alternative types such as Cerazette work by preventing ovulation as well. Less than 1 in 100 women will get pregnant over 1 year. Advantages: Can be used by most women who are overweight, smoke, or have medical issues. Safe in breastfeeding, can be started immediately after the birth. No delay in return of fertility after discontinuation. Works very quickly within 2 days of starting the first dose. More control over stopping contraception than with long-acting reversible contraceptives. Disadvantages: may experience temporary hormonal side effects like acne, headache, breast tenderness. May cause small ovarian cysts. Does not protect against STIs. Missed pills, vomiting or diarrhea can affect its efficiency. Very tight time window to avoid missed pill. Combined hormonal contraceptives, CHCs. The combined hormonal contraceptives contain 2 hormones, estrogen and progestogens, which work mainly by preventing ovulation. The pill form is a common form of contraception for women around the world. Alternative ways of taking CHCs include the weekly patch or ring form. Different combinations of hormones may be used as they have different pros and cons. They are taken either daily for 21 days and a 7-day pill-free interval, or continuously without stopping. It is usually not recommended for women within 6 weeks of delivery. While studies have shown it is safe in breastfeeding, some women may choose to avoid it while breastfeeding, as small amounts of estrogen may be excreted in breast milk. If a pill is missed by more than 12 hours, there is a risk of pregnancy. Fewer than 1 in 1,000 women will get pregnant over 1 year. Advantages: menstruation becomes more regular, lesser and less painful. Suitable for women up to 50 years if you're healthy and don't smoke. Reduced risk of ovarian and colon cancer and ovarian cysts. May improve acne. Does not cause weight gain. Easier dosing schedule than progesterone-only pills. More control over stopping contraception than with long-acting reversible contraceptives. Disadvantages: breakthrough bleeding in first few months. Interacts with various drugs and medical conditions. Usually avoided in obese women, heavy smokers, personal history of breast cancer, or high risk of blood clots. Small risk of serious side effects like blood clots in legs. Temporary hormonal side effects like breast tenderness, nausea, mood swings, headache. It does not protect against STIs. For the pill form, missed pills, vomiting or diarrhea can affect its efficiency. Lower short-term cost, but can be more costly than long-acting reversible contraceptives over long term. Sterilization is a permanent method of contraception. Female sterilization should be discussed extensively before delivery, as it is a major decision and is not easily reversed. Factors that contribute to a decision to reverse sterilization include young age when undergoing the procedure, unstable relationship status, desire for more children, and poor health in children. At the time of delivery, if a cesarean section is needed, it can easily be performed by tying off or placing small stainless steel clips at the fallopian tubes to block it off and prevent the sperm from meeting the egg. After delivery, it can be done as a keyhole procedure and typically involves the application of the clip as a day surgery. Less than 1 in 200 will get pregnant. There is a very small failure rate. Advantages: contraception is no longer required. It is non-hormonal and menstruation is unaffected. Disadvantages: procedure is performed under general anesthesia unless at the time of a cesarean section. Surgical risks are present. Small risk of ectopic pregnancy if operation fails. It cannot be reversed easily and hence should be done only if family is complete. Both fallopian tubes must be accessible. If one tube is not easily reached due to previous surgery or infection, this procedure will not be successful. Higher regret rate if done under 30 years of age or if done at the time of delivery or abortion. Male sterilization. The tubes which carry the sperm from the testicles to the penis are cut and sealed. The procedure prevents the sperm from leaving the body. Less than 1 in 2,000 male sterilizations fail. It is usually performed as a day surgery under general anesthesia, although it may also be performed under local anesthesia. The operations carry some risks, including chronic testicular pain. It does not work immediately. Contraception is required until it is confirmed there is no sperm in the semen analysis. This can take 8 to 12 weeks. Thank you for watching this video. This video is presented by Yong Lu Lin School of Medicine's Department of Obstetrics and Gynecology. For more videos like this, head on to the National University of Singapore's website.